this evening, and it's really a privilege to be here, and I was quite humbled to be asked to do this. And I think it's what appears to be a great series in terms of us reaching out to each other in terms of how we can share our own personal faith experience, particularly in our professions. And I know we're here to share that faith experience in terms of our professional our lives. And as a family physician, and I do practice here in the community in Niles, affiliated with Resurrection Medical Center, and enjoy being close to the community that I live in. It makes a big difference for me because you get to see it from so many different angles, not just from the perspective of the health perspective in terms of maybe the talents from my professional training, but more importantly in terms of involvement in the community, this faith community particularly, which is the most important element of my life. So all these things come together and they make it somewhat, I wouldn't say easy to do, but something that is a constant reminder of what my role is in everyday life as a professional person in the community and serving those people in the community. And I know we're supposed to give some examples of how we relate to our faith within our profession. And this was earlier in my career. I did my training at Resurrection Medical Center, and we deal with a wide variety of payer mix clients over there, patients who come in with a lot of varied situations. And I had a young lady come in who was, she was not married, and she was distraught because she found out that she was pregnant and she had no support system. And one of the great gifts of being in family practice, you basically see everybody from the time even we do obstetrical care, and some of us choose not to do it after we finish our training, which I don't, but during my training we did a lot of obstetrical care and care of the pregnant women and their unborn children. And she was looking for some help, and yet it was obvious she was pregnant, so from the medical perspective there wasn't a whole lot to be said there, but she was looking for some additional help. And I've been involved in the pro-life movement as a child, and it was impressed upon me through my parents the value of life, of course, and we recognize that in our faith as well, which is a great compliment. And she was looking for some assistance, and I really, I could give her medical advice, but she was looking for more than that. And just understanding the importance, because she was kind of in a quagmire as far as what she was going to proceed, because we live in a world where life doesn't get that same respect as we hoped it always would or should. And consequently, through my work with pro-life, I was able to connect this young lady with the Women's Center where she could get that support that she needed. It was something that, ingrained from my youthful days, the importance of life, and emphasizing to them that life is a gift, and there are supports out there that can support this even difficult situation for this unmarried woman and being pregnant. And that's one of the things is that what's great about our faith is that we treasure life, and we treasure it from conception to natural death. So as a family practitioner, I'm involved from the almost beginning, at least when I did obstetrical care in my residency, and then subsequent to that, I'm still involved in teaching over at with the residents. So I still do some of that. But then there's the other part of life too that we deal with too, which is the end of life, or what we refer as natural death. And I had a recent experience where a 75-year-old woman had come in, and she had been sick for a while and wasn't doing very well. and she had a mild stroke, and unfortunately, mild strokes can progress to more aggressive strokes, and she continued to deteriorate. And I had the opportunity to share with her that things were going to be okay, and we were going to do everything we could for her, but the family was having a lot of difficulty with the issue of the idea that she wasn't going to make it and stuff like that. And it was because of my faith and what I've grown to know and the value of life, that not only do we celebrate the beginning of life, we also celebrate the end of life in terms of when it's time. And we're called in a situation. Now, fortunately, this family was a faith-filled family, so it was a little bit easier for me to do it, but nevertheless, you can only imagine how awkward it can be, these difficult things. But I had known the family for a number of years, and it was more or less talking to a family member anyways, because that's how you kind of grow with your patient. And soon after, we were willing to understand and accept the fact that we did everything we could, and that obviously things were not going to be as we thought. And the great thing about it is that she was able to pass very peacefully within a very short period of time. And generally we like to get hospice involved in things like this, but we didn't even have to do that. The good Lord answered our call sooner than I had to call hospice, so it made it a lot easier for the family during this difficult time. So those are two of my examples that kind of tie the whole what I do as a family practitioner from kind of like the beginning of life, to the end. And because of my upbringing and my faith, it made things a little more even understandable for me. And so that I could somehow translate a message beyond what medicine could provide that I didn't learn in school. And it's always a gift that I treasure, and that's why I constantly share it with the people in my practice. And now it's not always easy, because you never know what other people's faith experiences are and what they and where they're at. And that's really not the important thing, is because we are who we are. And we shouldn't hide behind anything but who we are, and we shouldn't be afraid to be that person. And now people will, accept it many different ways, but I think if you're sincere in your heart and people see that it makes it a whole lot more genuine and an even more rewarding experience for all people involved. But I'm going to kind of carry on and move on to the second phase of my talk, I guess is what we would call it. But I think the thing is that when you think of your faith and your profession, I mentioned that it's important that you have as many other things right than just not your profession, and then everything being an extension of that. So when you go into professional life, it makes even that more rewarding. But St. Francis of Assisi said very succinctly, preach the gospel, but use words if necessary. And I think that's really what it's about, living the gospel. And we say things, but it's more important how we act and how we relate to people in that way, in terms of expressing our faith experience. And then people do recognize that. The other side of the talk, I guess I'm supposed to share with you some practical information about, as a family physician, what could I tell you as a family physician? Most people in this room probably have doctors already, but some of the things I thought about was, when you're looking for a physician, how would you identify maybe somebody who was in the community. It doesn't necessarily have to, because people find doctors in many different ways. And the only way I can tell you this is that when I was going through my training, a very wise mentor of mine said that, Paul, they know you know something. They figure that much. You know, you've come this far. You know, you've gone to school, you graduate, you're in your residency, you're going to graduate soon. He says, they assume you know all that stuff. But the thing is that that's not what they're looking for. They're looking for people who care. He says, until they know how much you care, they really don't give a hoot about what you know. And I took that to heart, and I tried to kind of live that. And I tell people when they're looking for a physician, you know, that those are the things you got to look for. And the way you can do that is obviously relate to your family and friends and outreach to those people who can maybe help you, you know, have their own experience shared with you as far as what kind of physician you're looking for. And, you know, that's a good way of doing it. And some of the other things that people look for, you can go on the internet and just about get it, you know, a profile of almost any other physician. But those are some of the things. And I'm going to kind of tie things up here. I didn't realize that my time was moving so fast here. But I was just going to say, I was getting hot up here for a minute, and I thought, well, God, what happened if I passed out and hit my head on this pulpit? But I was grateful to know that Dr. Mark Sechon's here. You don't even have to call 911. He knows how to resuscitate me. So, but, you know, I am a family physician, but I'm trained in the osteopathic profession. And it's a philosophy of medicine that kind of encompasses a lot of what I was talking about, that mind, body, spirit, that holistic approach. Many parts, one body, and that's really what holistic osteopathic medicine is about. It basically defines that, you know, the body can inherently heal thyself, but we have to create that environment. It's sometimes through diet, exercise, and a multitude of venues that are available to people, you know, in terms of, you know, conventional medical care, and those are, you know, and that's why for me, in terms of in my own faith experience and understanding that whole many parts, one body, it's the same thing that kind of was my training philosophy of medical care. So it tied, even though it wasn't religious based per se, but it kind of was something that really worked well to me in terms of creating that environment, in terms of making that next bridge to my next element of my professional life, and then going into family practice. And if anybody is interested, before the end of the evening, I do have some brochures, if you're interested, that explain what osteopathic medicine is about. But with no, I just want to thank you for the opportunity to come and speak, and I hope you enjoyed yourself as much as I did. So. Questions, I guess.
What's your name?
Meyer. I'm sorry. Yeah. I was introduced, so I'm too humble to reintroduce myself. Yeah, I'm sorry. Yes? It was in reference to end-of-life issues when people maybe what appears to be the natural end, and where morphine is used in terms of not assisting per se, but providing comfort measures. One thing about morphine, it's one of those drugs that, if used inappropriately, will cause respiratory failure, obviously at lethal doses. But the dosing in which it is used is more for comfort measures. A lot of times people at the end of their life get what we call air hunger. And what the morphine is allowed to do is it relaxes the pulmonary muscles and allows them to breathe with more comfort than they have what appears to be more just stressful breathing. But it's used at very therapeutic doses. It's not used at lethal doses, to your question. So, I mean, the reality is that it does not assist, or I mean, we use that a lot of times when we recognize the natural end of life, but it's for the purpose of therapeutic reasons. It's not for the purpose of, you know, prematurely ending life in any way. I think that's the gift of it all, is that, especially what our faith teaches us, is that we dignify life, and that's the gift of it. And I think that even in that particular situation, the situation was dignified, and I'm sure it was your mother you had mentioned? Yes. And she was able to pass peacefully, I imagine, and which is a special gift. And anybody's ever been able to be by the bedside of somebody to pass peacefully is really a treasure. I mean, because you celebrate a special thing there in terms of knowing where they're going. That's the gift of it all, you know, and that's where that's why for me, I see, you know, life every day in terms of, I was talking about from the one side where babies being born, but I see it so many the other way. But for me, it's quite rewarding knowing that that there is a place where they're going, and of course we all don't know where we are in that journey, and that's why we continue to pray beyond that for people, so that wherever they are, they eventually will, we all want to be. All right.
Thanks.
All right. Thanks.